Welcome to Morning Infusion with Dr. V. Have you ever wondered what it would be like to be a nurse entrepreneur? Well, my name is Dr. Viola Pierce, owner and the CEO of VP Nursing and the Nurse Nurturer, where our goal is to equip healthcare professionals to be spiritually and physically fit, financially stable, able to lead with integrity, to decrease error at the bedside and in leadership, to lead a full, empowered life. Our goal is to come to you each Monday, Wednesday, and Friday at 7:30 a.m. Eastern Standard Time to give you the fuel to crush your goals, to show up exceptional on a daily basis. You can follow us on Twitter at the Nurse Nurturer, Instagram at VP Nursing, and if you are watching us on YouTube, don't forget to hit the subscribe button. You can also visit our website at www.vpnursing.com. And guys, if you missed the summit, you missed an amazing event. So we have a special guest today, Dr. Tamika Williams. Tamika Williams is a clinical assistant professor of nursing at East Carolina University. She is dually certified adult gerontological, say that 10 times twice, nurse practitioner with clinical practice experience and a long-term care, inpatient rehabilitation, and employee wellness care occupational health. She graduated from North Carolina A&T State University, Aggie, in 1998, receiving a Bachelor of Science in Nursing. And from the University of North Carolina at Greensboro, UNC, she's after all my hearts. And in 2003, with a Master's of Science in Nursing. And in 2016, completing her doctorate in nursing. Her research and scholarship interest areas include long-term care, gerontology, health promotion, and social justice issues in healthcare. Additionally, she is the owner of Golden Health Education and Consulting, offering health education and consulting services to patients, families, and communities. So welcome. Super excited to have you.
Yeah, so excited to be here. So excited to be with you.
So, have you always been a nurse? And if you are, just kind of give us a history of your nursing background.
So, not always a nurse. I think, like in my early jobs, if you want to go back that far, I worked a fast food job before I became a nurse.
Me too.
Yes, you just have to have that experience. So, but when I got into nursing, I started as a CNA. Yeah. And so I worked as a CNA for several years on a rehab unit in a hospital. And I did the long-term rehab and the short-term rehab. So short-term being like people who had hip and knee replacement, long-term rehab for people who had extended hospitalizations and just needed to recover a little bit longer, or spinal cord injuries and the like, that kind of thing. So I worked that job the whole time I was in undergraduate nursing school. And then when I got out of nursing school, first job was in a nurse extern program at a hospital a little bit outside of Greensboro, and did rotations in cardiology, oncology, and there was one more unit I was on, maybe med surg, but I ended up going back to telemetry. Absolutely loved telemetry, fell in love with cardiology, and stayed there the entire time I was at that hospital. So worked telemetry for about a year and a half or two, and then transferred to a hospital closer to my home back in Greensboro, and was still in cardiology, but this time bumped it up a little bit to CT surgery, so open heart surgery. Even more exciting with cardiology. So now working with surgeons, you get your ACLS and all of that kind of stuff. Just very exciting. And I worked there for like 4 years on that unit. Absolutely loved it. And then during that time is when I started MP school. And so then transitioned into my MP role after I graduated, left that hospital, went to another hospital, but still inpatient at this time, which I thought I was going to work inpatient forever because I absolutely love the hospital setting. At that time, I was working inpatient rehab. It's funny how our life makes circles. I started as a CNA on rehab. Now I'm an advanced practice nurse on a rehab unit. So It was my first NP job, and I worked there for almost 2 years, and then came out of the hospital and have been in the community setting as the nurse practitioner since then.
Yep. Yeah, and I think that is great. Like you went from CNA of your doctor
all the way up. Yes,
you get it, girl. You get it. I love it.
I've seen it all. Yes.
Yeah. So you have taken a non-traditional role in nursing by owning your own business. What was the main motivation for taking this non-traditional role?
So it's funny. I never, ever thought I would be a business owner. It was not like a plan that I had. In fact, I'm one of these people who love school. So it was kind of like, once I got out of school, I worked a few years. I was like, what else do I want to do? And I'd always end up back in school. So once you finish the doctorate, it's kind of like, okay, there's nothing else to do. No other degrees to get, right?
Right.
And you don't need to keep spending that kind of money. But anyway, once I finished, at this time I'm teaching. So I had started my academic job probably about 5 years prior. I was still working as a nurse practitioner and got an invitation to try my hand at teaching. I had never taught before in the inpatient setting. I like to say that I was a teacher and have been as a preceptor because I love to precept. I would always precept. I would always take a student. And if I could have a student, I would, even as a nurse. And then when I became a nurse practitioner, always, yes, bring me the student. I love it. So when I got my official job at a university, started teaching, and then just was working my way in my academic job, which I still do. But I guess about 2 years ago now, I kept thinking, like, what else could I do with the knowledge that I have? Like, I like my job as an educator and as a nurse practitioner, love what I do, but I really was thinking about the community, like what kind of information I could give the community, and where did I see a break or a gap? And because I love long-term care, which is you don't always hear people just love the nursing homes or the long-term care world, but that's kind of where my passions are. I thought, you know what, I might need to try my hand at doing something specifically in the realm of education and providing consulting services to this dynamic, because they sometimes don't get a lot of attention. So the motivation there was, what can I give out to the community that wasn't there, and how could I support them in this area that I kind of love? Yeah. And that's it really was an idea. Like,
yeah, identifying the gap. And right. That's huge, right? Mm-hmm. Because you want to ensure that healthcare is supported as much as you can, and we have the gap. I mean,
absolutely, we do.
And so I think that is that's pretty sweet how you have identified that gap, and you have said, okay, let's go and tackle that gap. Let's take care of that. That's pretty phenomenal. So how has the pandemic affected your business? Has the business increased or has it decreased?
So I would still consider myself a novice business owner because I just started the business last year. We're over our 1 year mark. And so I would say the pandemic has allowed me to expand what I'm continuing to learn about being a business owner. I have not, during this time, because we're talking now March, I guess, when the pandemic really hit us, so now I haven't been able to be in like literal facilities, but I have had conversations with administration and professionals in those settings to work on opportunities that could be forthcoming. So we've had some great conversations about needs, wants, and strategically trying to map out the services that I can offer. Because the fall is upon us, and we know what the season is going to be looking like, especially in long-term care, where we're still like no visitation and that kind of thing. A lot of facilities have some needs, especially staff. And I'm really interested in staff development in these places, and how we can help the facilities with retention and those kinds of things. So we'll we've got some things in the works. So I would say the pandemic has allowed me to grow more as a business owner with what I'm learning about how to manage the business. We haven't done any like face-to-face talks during this time just because of how we are right now.
Right. Mm-hmm. Yeah, it's identifying those pain points, because the pain points kind of shift, right?
Absolutely.
Based on the pandemic, right?
Absolutely.
So that is huge. So yes. So nurses that want to start a business while still in the current job, what is some of the advice that you would give them?
Oh my. So I've had the pleasure of working with 2 business coaches at this point. 2 business coaches at this point. And both have really talked about the time commitment needed to, one, start a business and manage the business. And so, I mean, it is, so you've got to go into it with the mindset of, I'm going to need some time to commit to this. And I, like everyone else, have competing demands. You know, if you're working full time, I mean, 40 hours of your week is taken up with your full-time job. You've got to figure out where are you going to fit in another, and actually the recommendation is like 10 to 20 a week to really hone in and get your business up and going. So I would say my advice, if you're starting, you're still working full time, you're really going to have to look at your schedule, early mornings, late nights, to figure out time. And I do know this, you're going to have to be intentional about spending time on the business. It's right. Because if you don't do it, things won't get done.
That's right.
Yeah.
That's right.
It's got to be an everyday kind of, you've got to put it, I've got it mapped out in my schedule. Like I've got to have some time toward the business. If not, and even if it's answering an email or reaching out to so-and-so or looking up something, like you've got to put in the time. If you don't, the business won't move forward. So it's hard. It would be ideal if we weren't working full time. Then you could have more time but you can do it. Many have started businesses working full time. So many have done it. You just got to figure out your schedule, the time.
You know, one of the things that from my business coach, I really have learned a lot about time management, how to make sure that I allot that time, and I do allot that time. You know, I think best in the morning. And so I kind of come at it from when I was in school, right? So when I was in school, I would study in the morning or I would write papers in the morning. And so I work on the business best in the mornings. And so identifying that, knowing where your gaps are, and having a coach is huge.
It's huge.
And having that pace, you're able to collaborate with someone else to make sure that they see what you're doing and they can advise you, because you don't need people around you telling you all the time that you're doing great and wonderful. You want people around you that tell you, you know, where your gaps are so that you can get better, right? I mean, I know it's cute and everything for people to tell you that you're phenomenal. Right. And I like that, right? I mean, you know, who doesn't?
Who doesn't? But I think we need to challenge you. Yes.
Exactly. Yeah. So now, what is the hardest part of being in business for yourself?
I would say not knowing what I don't know. Like, I don't know what I don't know yet. Right. So it's a whole new world. I mean, we're nurses, and so I'm sure at some point in our trajectory have heard the Patricia Benner novice to expert kind of trajectory, the bell curve, where you go from being a novice to being an expert. And I feel like I'm back at being a novice because I know my specialty, but I'm a novice at running a business, a true novice. Like, what does that mean? And in nursing education and preparation, we don't really talk about entrepreneurship. So you're right. It's seeking out information, investing in coaching, to help you to learn the things of a business that you don't know. We know our specialty well, but we don't know business well. And so it is, I think the hardest part is not knowing what I don't know that I need to know yet. And so it's kind of figuring it out. So it's uncharted territory. It's uncomfortable being a novice, but you will go through it. It's uncomfortable.
That's right. One of the things that I've always said that if you can't breathe, I'm your girl. Okay.
Right.
All right.
Right.
I'm your girl because I was an ER nurse for years, right?
Right.
But the whole business thing, it is, being that novice and
Yeah.
advance into those next levels.
Mhm.
And John Maxwell, because I'm a John Maxwell certified coach and trainer, and one of the things that they teach in one of their when I went to his seminar or his conference is that they told us to take it was a page full of numbers, right?
Uh-huh.
And
Mhm.
so all the numbers, he said, I want you to, in succession of each other, get to 100. So of course the timing was very short, and I got to 8 numbers, right? And
Right.
so
Right.
then he said, I want you to fold the paper in half and then fold it in fours. He said, in the top left-hand corner is number 1, top right-hand corner is number 2, bottom left-hand corner is number 3, bottom right-hand corner is number 4, 5, 6, 7, 8, and
Uh-huh.
in that session. And
Yeah.
so then I got to, probably 20 some
Right.
numbers, right?
Right.
He said, what we're doing is we're teaching you the path, right? And as coaches, we teach you the path of how you get there and how you get there more efficiently and effectively,
Mhm.
in less time. So that was just a great
That's a great
representation.
nugget. Yes.
Great representation.
Absolutely. We need it.
So, what is the best part of being in business for yourself?
Oh my. So it's really seeing an idea come from an idea to fruition. Like
Mm,
I had this idea and now I've actually put it into this thing and now it's actually manifested here. Like I never would have thought that, oh, I could package that up and make it a business structure and really think about, like, I do kind of know some things about this area that I could share. Yeah,
that's right.
I don't think we as nurses are empowered enough sometimes to articulate our expertise. We're not good at that.
Right.
A lot of times. And so that's been the best part, to just know that, wow, I actually had this idea and thought, okay, maybe I could do it. And I remember, I clearly remember using the analogy, like, I'm just going to get on this diving board and jump into 12 feet, not knowing whether I can swim or not, but I'm just going to jump. And hopefully I'll be at least able to float over here as a business owner. So I think that's
Yeah,
the best part.
I
Yeah.
think it is absolutely. And the service, right?
Yeah.
Because, when I think about the things that I needed to know that I didn't know,
Yes.
because our goal is to equip healthcare professionals to be spiritually and physically fit, and understanding that when you come out, I really did. I don't think that I knew that I was going to be affected in healthcare. I didn't really understand that I was going to be affected in the way in which I was. You
Mhm.
know, seeing patients come in and seeing the death and the dying, and
Right.
understanding that that is the lane that you chose. You chose emergency nursing, and so
Mhm.
emergency nursing gives you
That
that
lane.
that right. You're gonna have that a lot of times, and so you have to understand that and not be comfortable with that, but be you know how you manifest it for yourself in order for you to grow. Because if you can't grow, then the organization doesn't grow, the patient doesn't grow. The book kind of stops with you, and you growing is hugely important. Now, how do
Mhm.
you balance family, work, and the business?
So I'm a big proponent of calendars. I still use a paper calendar, which I absolutely adore and love. Now, I still have an Outlook calendar on my computer and get a lot of meeting requests and things through that for work and such. But my paper calendar is kind of like my Bible.
Gotcha.
so, and so Schedule. So a schedule. That's one thing. And then I also believe balance comes with making sure you don't forget about you. You've got to maintain your self-care. You've got to have time for you. I always tell other nurses that I'm working with, like to help mentor them, that you've got to have some play in your life, whatever play is for you. Play could be that I just want to spend the evening reading this book that has nothing to do with nursing, nothing to do with professionalism, nothing at all. It could just be trash, really, but that could be the play that you enjoy. And if that's what fills you, do it. I think a lot of times we do not do that as well. We are so ingrained and we're goal oriented. We want to accomplish our goals. We're driven people, but you've got to take a break sometime and relax, So I think balance is that, making sure you take care of your self-care, having a schedule. And then I think checking in with people. Don't forget that you're not on the island by yourself. Sometimes you feel like you are. You do. You feel like I'm out here by myself and nobody can, like, check in with people, and not just your coaches, but other colleagues or what have you. Those kind of things help lift your spirits. They help keep you motivated as you're going through the process. The other thing that I have done is maintain this mantra that this is my journey. So I am assured that this is my journey, and my journey is going to look like mine. It's not going to look like Dr. Pierce's. So I should not compare myself to Dr. Pierce's journey. Okay.
The thief of all joy.
The thief of all joy is comparison. Exactly. And sometimes we can get in there and I'm thinking, oh my gosh, I've been in business a year. I should have already had this, and that. No. Your journey is your journey. And what is for me, I will get.
Exactly.
Who I'm supposed to touch, I will touch. Who I'm supposed to connect with, I will.
That's right.
I trust those things. So I'm very comfortable in that. And it's not I'm not in a rat race. I'm like, oh, I've got to hurry up and do it, because I really want to do things strategically and correctly. And I'm learning in the process. I'm not naive to know that I'm new at this. And so it's not that I don't want it to be productive and, of course, be financially beneficial to my life. But you have to grow to some points. And so I'm okay with the growing process. Yeah.
One of the things that is super important for me, and I heard this quote the other day. It says that your mail will never be delivered at someone else's mailbox.
Absolutely.
That thing. I mean, let me tell you something.
Yes.
I was like, okay, all right. I just be okay with how it goes, because I used to be upset when things didn't come my way. I used to be upset, and and of course, still you're in your feelings. But get up the next day and know that what God has for you is for you, and He's taking you in a different trajectory because of the fact that He knows what you can handle. He knows the higher of that. His ways are higher than your ways, and his thoughts are higher than your thoughts. I mean, I hate to get into a preacher session here, but
I know. I'm with you. Absolutely. If we can just stay there and recognize that our journey is our journey, it's not going to look like anybody else's, and that's okay. But our finish line is going to be different than theirs as well. But you won't miss what is for you. That is what I am assured of. You won't miss it. It's because it's for you. Nobody else can get it. Right? So, yeah.
I love it. I love it. So now, what advice would you give nurses to prevent burnout during this very difficult time?
So this time, I just said this recently, it's affecting us all, regardless of degree preparation, status in your job or what have you. This time right here, we have never been in. It is tough. Even if you haven't been touched directly by the virus, it's just the state of our world and everything. I mean, that just sums it up. Everything. So I think you have to go back to your center and your core and know that what you are doing in your career, what you are handling in your home, that those things you are doing the best that you can, and to give yourself grace. I don't know how many times I have said that to people lately. Give yourself grace.
That's a good word right there.
Because, even our best selves at this time have been challenged. And though some of us very driven type A folks like myself, the weight of it all can sometimes have your thinking cloudy, and you're not on your A game. Whether you feel like it or not, it's still there. It's the elephant in the room right now for everybody. And you might not be being touched in your finances, or you might not have a loved one that is sick, or your job might be secure, but still the unrest and uncertainty of this time is just enormous. And so I say, to prevent burnout right now, you have to give yourself grace. You have to tell yourself every day that I am doing my best. And wake up with the mantra that I'm going to do my best today. And my best today might not be my best tomorrow.
Right.
Because each day is presented with different challenges.
Right.
But again, give yourself grace. It's okay. And another thing would be to just extend compassion, because we're all dealing with this in different ways.
Right.
Like, even though I show up, you show up, and we're in our meetings, and we're smiling, and we're checking boxes off. No one knows the weight of this day personally for everybody. And so extend a little more compassion to others as well. But definitely give yourself grace, because right now it's not good to beat yourself up right now.
Tabitha Brown said yesterday, I love her too.
Yes.
Oh my God. She said yesterday, she said that she's in a lot of groups on Facebook, a lot of vegan groups. She said they're just, they're still bantering back and forth about you shouldn't eat this, you shouldn't eat that. Right. She said, we're in a very different time now, right? Yeah. And so, you need to extend some compassion to the person who may not be able to afford what you may be able to afford, right? May not be able to do the things that you are able to do. She said, she said it was a few of them that she had to come out of because of that.
Right.
And so, I think that's very important. Mm-hmm. So I just want to thank you first for coming on this platform with me. You've been amazing. If you are in a skilled nursing facility, do you do assisted living facilities also?
Assisted living. So long-term care can include assisted living, skilled nursing facility. Even it can extend out to group home settings, CCRCs. It's kind of a big term, but yeah, we can look at all of that.
Okay.
We can help.
So seek out Miss Tamika, Dr. Tamika Williams. Work it out, because she is amazing. I met her at a conference, and I thought, well, I've definitely got to get her on this show. My name is Dr. Viola Pierce. I'm the owner and CEO of VP Nursing and Nurse Nurturer. So we're coming to you every Monday, Wednesday, and Friday at 7:30 a.m. Eastern Standard Time to give you the fuel to crush your goals, to show up on an exceptional basis on a daily basis. You can follow us on Twitter at the Nurse Nurturer, Instagram at Nurse VP Nursing. And if you're watching on YouTube, don't forget to hit the subscribe button. You can also visit us on our website at www.vpnursing.com.